So in this video, I want to show you guys the many different collection tubes that we use when drawing blood in phlebotomy. Now, I don't have every tube there is. I'm missing some, but I have most of them. Okay, so you'll notice that every tube has a different color. Each tube is color coded. You can see the royal blue, the light blue, the red, the green, the purple, the gray. This is to make things easier in phlebotomy. This is to make things easier when we're drawing blood, and also it helps with the order of draw. Now I want to talk a little bit about each one. So these are the royal blue ones. These are different brands. So this one is the BD Vacutainer brand. This is another brand. These are used for trace elements. They have, if you can see that white powder, this would be the additive inside of it. So these are royal blue. These are the coagulation tubes for PT, PTT, INR, D-dimer. Again, these are different brands. This is the BD Vacutainer. This is a Vacuate. This is the Vacuate brand, and this is also another one. I want to draw your attention to something. These are different brands, like I said earlier, but they also come in different sizes. So this one, I'm going to show you that. It says here 2.7 mil. This one says 3.5 mil. And this one says 4.5 mil. So depending on the brand and depending on the size of the tube, the amount of blood that you would draw can vary. However, I will say that the amount of blood in the collection tube has to be proportionate to the additive inside of it. So if you notice, this one is the 4.5 mil, but it has the most additive. This one is the 3.5. It has less than this one, and then this one is a 2.7. It has less than the 3.5. Another thing is, for these tests, you must draw it to the top. They have a line, like this is the line. I'm not sure if you can see it, but this is the line. For this one, this is the mark where the blood's supposed to reach, and this one doesn't say, but you're supposed to fill them to the top, to the mark. If you were to fill this halfway, the sample would be rejected because the amount of blood in there is not proportionate to the amount of additive. You have to fill it to the mark. These are some of the red ones. Again, we have some different brands. All this can be used to do chemistries, serologies, and so forth. Again, we have the BD Vacutainer, the Vacuate. These are two different brands. This is the gold top. This is another gold top. This is a tiger top. And so they have clot activator in them. The purpose is to prevent the blood from, to cause the blood to clot. That is the purpose of the clot activator. This one is these two, they are serum separators, so they have clot activator in them, but they also have a serum separator, so that after you have drawn blood, you're gonna put this in the centrifuge. When it spins it, the serum separator is going to come between the blood cells and the serum. These ones they don't have a serum separator. Anyhow, you would still put them in the centrifuge to spin. After you're done, the red cells are going to be at the bottom and the serum going to be at the top. Then we have the green ones. These are heparin. This one is sodium heparin. This one is lithium heparin. They are the same brand. Again, different sizes. This one is a 10 ml. This one is a 4 ml. This is the purple top. It contains ethylene diamine tetraacetic acid. This is for CBCs, ESRs, blood group, and so on. If you can see the liquid inside of it, that is the anticoagulant. It is to prevent the blood from clotting. This has a mark here, but you don't necessarily have to fill it all the way to the top. You know, you can fill it to half. It would depend on how many tests you have to do. So it's not so critical for you to fill it all the way to this mark for like a purple top, but for your blue top, it is important that you fill it to the top. And then we have our gray top. These are the same brand. They contain sodium fluoride, potassium oxalate. The powder, you can see that white powder, this is the anticoagulant. It helps prevent the blood from clotting. For example, if you're gonna use this to do a glucose test, like a fasting blood sugar, after you draw the blood, you would give it a few moments, and then you would spin it in a centrifuge, and then you're gonna have the cells below and the plasma. You're gonna have the cells at the bottom and the plasma on top. So I hope this was somehow helpful. I just wanted to give you a idea, a showing of the different kind of tubes that we use when we're drawing blood. It is pretty. I know you're thinking the same thing. Okay guys, so I hope this was helpful. Study hard, work hard, and all the best doing phlebotomy.